thank you so much for taking your time to come down to Access Care, get your teeth cleaned, perfect teeth over here from birth. I mean, I'm just still shocked at that. Say, no braces.
No.
Bravo. I mean, fantastic.
She's one of the lucky ones.
Yeah, yeah. So you both work at State Farm. You heard about this crazy thing of a mobile dental practice coming down, and you're like, okay, I'll go give it a try.
Yeah, Sunny did it first. And then
Yeah,
sent it
I
to
just,
me.
I don't know, I got the email and I was like, you know what, I had insurance in a while, so,
Yeah.
and I also didn't get my teeth checked out, so I told her, I was like, let's go, and we'll get her done while we're at school. Luckily, it was the same day we're in office, so
Yeah?
it was a no-brainer.
Yeah.
Yeah.
So, and when you say in office, so do you have you can work from home sometimes?
Yes.
Oh, that's cool.
What we come to the office one day a week.
Every Tuesday.
Only one day a week?
Only one day.
Fantastic.
Yeah, we have to show our face one
And
day a week.
how far is the drive from home for you guys? Or
25 minutes for me, but she's way
I'm
closer.
literally 9 minutes door to door.
She can walk
parking,
here.
Everything. Yeah, it's
She can walk here.
And what do you do for? Are you in the both the same
Yeah.
department or what do you
Life
do?
claims.
Life claims.
Yes.
Okay.
So if your auntie passes,
You know,
we
we're
help
paying.
you fill out the paperwork and send the check
nice.
to you.
Nice.
Yeah.
We work with your agent.
That's great. And you were saying that you moved here to Phoenix to also help with your family.
Yes, that's right. I moved here to help look after my mom,
Yeah.
so it's been a big change.
So, I mean, it's amazing. You're doing
Thank
that.
you.
And I mean, but the fact that also you're helping other people that are going through a traumatic
Yeah, it's very
experience and
satisfying.
Super
wow.
satisfying. Stressful, but
Yeah.
it's good. It pays off. That's how
Yeah.
I feel like the payoff is worth
You
it.
can hear the impact when you're talking to people.
Yes.
Okay, so I'm 51 now. And,
You don't look like it, so
really?
that's good.
I mean,
Yeah.
I got those with this. And I got married a couple years ago to my lovely wife.
Congratulations.
And, thank you. And we recently she had a baby, and
Congrats.
I'm there to help.
That's a
I
wee.
suppose.
That's
a
awesome.
wee.
That's correct.
And so I was just thinking about getting life insurance. I mean, you'd think I would already have this stuff
Yeah.
handled at maybe a few years before, but so I just started looking into that. And I don't know. This is how probably I always think of State Farm as like auto insurance and everything.
Yeah.
So I might have to tell my broker is like, look, let's see if I get some life insurance through State
Yeah.
Farm.
Yes.
I-
Tell them to look into that.
Look
for
into
you.
it.
Yes.
You want to do the universal life is a good one.
Universal life.
Yes.
Okay.
Yeah, it's a good choice.
You can take money from it. You can add money to it. So it's, I guess, in comparison to traditional life policy, it's a lot more flexible.
Yeah.
Like what you can and can't do with it.
Okay.
Yeah. Traditional
Easy-
policies
easy
have
to trouble
restrictions.
to do, though.
Yeah. Like
Have your agent
Okay.
assess you, to see what your spending habits and what your
it all depends on how you invest in the
how much
policy.
insurance you
Right, because I remember years ago, like there was something like where you'd have it was a life insurance policy, but it also had some like
Value.
Yeah.
Yeah.
Like you can take a loan out on it.
You
Yeah.
can use it as
Yeah.
collateral. So
That's-
That's an option.
That's called universal.
yes.
That's one of them.
Okay.
There's a lot of them. Though.
There's a bunch, yeah, and they all have like kind of different features, but I think universal life is a little more flexible and like what money you can put into it,
Yeah.
and like taking money out and things like
you
that.
might need like a 10 year, 15 year.
10 or 15, yeah.
You might need a 10 or 15 term.
Term policy is also
You're
good
older.
because it'll pay up at the end of the term, so you'll have a fully paid up policy.
Oh, I like
Like
that.
if you were 30, it would be a different situation, but 50,
Yeah.
you want it
I only got
to
a
be
few
more
more years.
aggressive.
Yeah.
No, hopefully not. Hopefully not. Hopefully a bunch
No,
more.
Well, I mean,
years.
but to have value available, like when the baby grows up to
Yeah.
be, teenager, whatever, you'd want to be more aggressive.
And okay, you would think that we were talking about dentistry on this. now I'm like, you're getting some really good
Interesting.
information here.
Locked in.
But there's also, is it also that you can decide like, I don't want to say, I don't want to say the right word, not aggressive per se, but like, can you choose what the investment portion of it is?
Yeah.
So you can say, oh, well, I want this to be in this type of.
Yeah, you can tell them what you would like the outcome
Mhm.
to be, and then work your way back.
So they'll
Yeah.
kind of set it up for you, like
So did you know before you started working? Did you have to go through the whole licensing thing of like having?
No.
luckily for us, no.
Yeah.
Okay.
So we can't advise you. We do have to disclaimer.
Yeah.
Yes.
Yeah.
Yeah. Disclaimer.
We can
Disclaimer.
advise you,
Okay.
But your agent can.
Yeah.
But they do have options that are specific to
Mhm.
Yeah.
our age group. Yeah.
So, which is good. And that's the other thing is like, at least for this, you don't need, depending on what you're doing, you don't need to get licensed. You know?
Yeah.
But definitely speak to your agent
Yeah,
about
we
that.
yeah.
It'll
can't
give you-
sell insurance.
Right.
obviously.
Right. Okay. Well, Make sure that we're
No, you're
clear.
fine.
Yeah,
You're
on the-
fine.
On the dental.
Okay, so we'll go back to so okay, you hadn't had dental insurance
Mhm.
for a while. This was convenient. It's the day that it just so happened to be both on the same day. Um, how was the experience? And
It was
I want the
great.
good, the bad, the ugly.
It was
don't,
great.
Don't feel like you gotta,
I thought it was great. I
Yeah.
thought everybody was super friendly. I mean, they gave us a bunch of freebies. The doc told me, unfortunately they couldn't clean mine here, but
Yeah.
it's fine. I
Oh, they
understand.
didn't clean?
She couldn't because I needed it. My
deep
gums
clean.
are too inflamed, so she's like, I'm gonna have to numb your mouth.
Yep.
But I think it's a very, I would say like progressive, this method of care.
Yeah.
It's a lot more accessible for people who might not have the option to make it to the dentist's office, but they are in the office
Yeah.
and they have an option to do this. That's what I told
You
her.
get time off work.
And we
Yeah.
get time off work, so that's
Did you
also
get,
nice.
You get like an incentive too. Like sometimes if you get like biometrics and labs of some companies.
Oh yeah,
they
they
give you like
the
a
screening. So I wouldn't not for the dental one, but I know for our blood tests and our blood exams,
Oh,
they
yeah,
give
yeah.
us like
So
a
if
$15
you
rebate,
go to Quest and get your blood work done and all that, you
Yeah.
get $15
which we need to do
a
too.
month.
Yeah, yeah.
And
It's
then
gonna, at the
So
end
it's
of
a
the
team
it'll be
again.
done by August or October.
October.
no end of October. So we have till the end of the month to still do.
You have to go to Quest.
Yeah.
The challenge is, here's my challenge. You have to fast,
Oh yeah.
Yeah.
and then
the
you
day
have
before.
to literally go in. And
Yeah.
so we'd have to take like.
Yeah,
morning
no,
off.
that would be hectic.
You want to go in the morning, not in the evening. 'Cause
Yeah,
Right.
because you have to fast the whole day.
Yes.
So there's a couple things, and I don't want to forget this. Is that so? One, you said the deep cleaning in to kind of numb you up, which can happen if you haven't been. I'm not a clinician, so I'm not. Either, so, but like
Disclaimer.
being around, disclaimer. So being around it a lot over the years.
Of course, you begin to learn stuff.
Yeah, and it's common that you have to do it. Now, we are talking with clients, and hopefully this is something with State Farm too, is to do what we call like more of a continuity of care model, where we're going to come back on a more frequent basis.
That would be
and then
awesome.
when we do that, when clients like Workday's one of our clients in Ireland that we do this for, we're there every week. They've actually a smaller
Oh,
campus.
wow.
than
Oh, for
this.
workday?
Yeah.
Oh,
yeah.
nice.
We're there every Wednesday with a dentist, and this has been for years now. But we do more comprehensive work, so we could do that
Yes, sir.
when we have a more regular schedule.
Yeah.
But we feel like if we're not here enough, we'd rather just kind of be more conservative.
Yes.
And then say, like, hey, if we
Which
find
makes
something,
sense.
let's pair you with somebody outside to
Yeah.
get that deep cleaning done. But that could be. I mean, it could be because I don't know. Even if you're only here one day a
Out of the
week,
week.
but you got a
We could
large
come
number
next
of
Tuesday.
Yeah, there you go. Next Tuesday.
Yeah.
Right.
But I mean, if there had to be a follow-up, it could happen.
Yeah.
Yeah.
So we do. So we definitely do that. As if that turns out to be something that is available, and the powers that be, say, to come back, we could do that. And then the thing you mentioned in regards to your biometrics and labs, the reason why we named the company Access Care is that we thought the dentist is turning out to be the primary care provider of the future, because a person is in the United States is twice more likely to see a dentist in a given year than to see a primary care provider. And even for different demographics, fluency levels, it's still about the same. That
People
people
go
are
to the
more
dentist more than
likely.
the doctor?
Yeah.
Well,
Now-
that's true for me too.
Yeah. So like people come
I've
to.
gone to the dentist 2 years ago, and I haven't been to the doctor.
Yeah.
Yeah.
Like, if it's not
Same,
falling
same.
off,
I
I'm
would
not
say the
coming.
same. Yeah, she said if it's not falling off.
And
Oh my god.
and for men, we typically are worse.
Yeah, way
About
worse,
going-
for sure.
I
I
mean,
would
if you-
say.
if you- so. Like we sit back and wait.
It's been like 3 years for me since I went to the doc.
Yeah.
So it's been a long time. But yeah, the dentist, I would
Nothing's
say.
falling off, right?
Yeah, nothing's falling off.
Yeah.
Thankfully,
Yeah.
nothing's falling
Yeah.
off yet.
Okay. We gotta keep this PG. Okay. So like, sorry. No. So yeah. So it was. So now with as Access Care, we can. Within a dental environment, there's so many good assessments that you can do. So for like your hearing,
Yeah.
or even vision, like we're at
I think
Honeywell.
vision would be great. I
Yeah.
put that on my little survey.
Great, thank you. Thank you.
I put yeah.
That is not so invasive either.
Yeah. Okay, let me ask you the question. And don't be influenced by each other. Give your own
Yeah.
opinion. Would you have more would you have a sense that that a vision or a dental is more personal? Like feeling like you want to have more loyalty to one.
Yes, for sure.
Which one though?
I would say we would say. Are you saying in terms of vision or dental?
Yeah, which do you think has
My
more of like
so
a connection
I
point?
guess
I
would-
know mine.
I would say dental, just because at least my
I
eyes,
know.
my eyes are I'm okay. Like I got
Interesting,
good
yeah.
vision, but I feel like with the dentist, I feel like a lot more things can go wrong as far as your teeth.
Yeah.
Not saying that it can't with your eyes,
Okay.
but I feel like at least for me it would be dental.
Yeah.
Just to
That's
just because.
way more personal.
Yeah.
Really, just because they're in.
Because they're
Yeah, they are.
I mean, I've also think.
I mean, you're like they're in your face and they're in your mouth. They're like putting their hands in your mouth.
I hear you. I've also think it's like of course I don't want to.
It's sanitation.
Yeah.
It's
Yeah.
the same thing too.
But I think your eyes are like you lose your sight.
That's the scary portion.
Yeah.
I feel like it's more delicate with the eyes.
Mhm.
Like they have to put more. But
What's the worst that can go wrong with your eyes?
they poke your eye. That's like my biggest fear is like
Yeah,
they're
yeah.
like holding this thing open and all of a sudden a needle comes into your eye and I'm like, oh my god, I don't want to deal with that
What
at
is
all.
that?
I'm just saying, I haven't seen them.
I got that LASIK thing done like
Oh,
15
it's
years ago.
scary.
It's. I mean, this is 15 years ago. I mean, so.
Technology is
Techno-
better now.
Yeah.
Where is it today? Yeah, I have no idea, but I mean, I just remember they were like, like they had to like
The pries,
lock
they
you
had to like
down,
pry open,
and then,
right?
And then they do it like it's step by step, little by little, but it also
Way
you're not
scarier.
moving. Your head's not moving, your eyes not moving. It's like, but anyways, that's
Yeah.
that's your average. But
Yeah.
but yeah, we can do for eye health like. Diabetes retinopathy, 50% of the population finds out that they're either pre-diabetic or diabetic just by going to see a eye doctor.
I didn't know that.
Yeah,
I
crazy.
didn't know that had a
50%.
connection with it.
That's
Yeah,
why
'cause-
when you eat sugar, you can't like you probably don't have to worry about it, but like when I eat sugar, I can't read. Like my sight gets worse. It's 'cause
What?
the-
I
Wow,
didn't
really?
know that.
Yeah, the glucose affects your vision.
That's crazy.
Yeah, if you eat better and don't have sugar, your eyesight will actually improve.
Well,
do you cut out sugar in your diet?
we got candy buckets of candy in the office.
Skittles
Oh, right. Good. So,
I went to the
somebody-
dentist with a bag of candy.
we do that. It's to get really the sticky stuff. We need to like really, and it pulls out the fillings, and then
yeah.
we got work. No, I'm joking. No, we don't.
That
Make them work twice as hard.
Right.
Yeah, the dentist was very knowledgeable. Like she shared stuff with me.
Yeah,
Not
she
really.
was
Yeah.
for sure. Very
Yeah.
sweet and very like
Yeah.
she made it because I told her like personally for me my teeth are like my biggest sense of insecurity.
Really?
Just yeah, they are. And like but she was very sweet about it. And she was very kind and she told me she's like you need to actually go and get a deep cleaning done
Yeah.
because we don't have tools for your inflamed gums.
Yeah.
But yeah, I think that she was very nice and very sweet and super personable.
Yeah. And she told me stuff I didn't know. Like you don't want to use the same toothpaste. You want to finish a tube and then alternate to a different brand.
No
I didn't know
I
that
didn't know
either.
that.
Because the bacteria in your mouth will
You get used
it.
to the toothpaste
So it loses its
effectiveness. That's crazy. I didn't know that till today.
It loses its efficacy.
I don't know.
I didn't know that till today either.
Yeah.
I didn't.
Wow.
That's a
Yeah.
cool fact.
Okay, so you've given some really good information here. In fact, I have to say, probably the best the duo is like you feeding off
The
Take us all
dynamic
the way.
duo.
Hey, we'll take you with us. Just jump in here and we'll go to the next one. I've got Honeywell in a week, I think. Yeah, so just down the road.
That's fun.
Yeah. So, but anything we can work on, like anything that we could get better about.
She was struggling a bit with some of the equipment. Like,
Yeah.
wasn't responding like she wanted it to.
Good.
But that didn't really hurt or affect me.
Okay.
Unfortunately for me, I
was happy.
wasn't in there for enough time to see
Okay.
anything. But
I will definitely get with them after this. I'll be
Yeah,
running.
the X-rays were not. They were better than doing them in the.
the
office.
dentist
Yeah.
lab, yeah, that was
Good.
a lot
Good.
better. I like the way
Yeah,
that she
just
set
pop
that
in,
up
pop
too,
out.
Yeah.
versus having to go under and having them sit there with the actual giant X-ray.
Yeah, right.
the
And you're
metal
sitting-
plate
yeah.
issue.
Yeah.
That was
We
nice.
try and make it. Actually, we learned this from the U.S. military. We did some
Scares
like how we do the X-rays is a little bit from what we learned from them, how to make it more efficient and more comfortable. But
Yeah.
But that was great. So
And they
okay.
made you feel really welcome. Like
Yeah,
she's,
I
like,
loved it.
sitting-
Everybody was
sitting
super
right. I'm
nice.
like, that seat, the only seat here. You want me to sit in your seat? And she's like, yeah, it's my seat. I have a seat.
Yeah.
And I'm like, okay.
Well,
That's it.
what we're trying to do is because in a normal dental practice or normal practice, they say like a provider only gets an average 6 minutes with a patient. Not in dentistry, but like primary care is like 6 minutes. It's so fast. I think what State Farm and other best workplaces are trying to do is that the environment needs to be more around the health engagement session. Rather than claim, process to so that's what we're trying to do is just to make it so that you get that what I think you both talked about is this education level, this interaction that you have with the provider that
Yes.
makes it okay. State Farm has an amazing brand, right? I mean that brand value of just a name. So what we have to do here is try and give you something that's
Say, yeah,
equal
something
or
of-
better
in
than
value.
that. So I just want to say thank you both so much.
Thank you.
I really appreciate it. I mean, I know you're busy. I know you only got so many hours a day in the office, but it means a lot that you spend
Yes,
time
sir.
to come down and see the clinicians and
This was
definitely sit
awesome.
down with me. And
This
yeah.
was awesome. We hope you guys come back soon, so that'll be good.
Yeah, we'll encourage our
Next
peers
time,
to
next time I
take
visit,
advantage of
hopefully
it.
I'll have my cleaning done, so we don't have to worry about that anymore.
Well, and maybe we'll have some other health services
Yeah.
and take care of your eyes
Yes,
and
vision.
biometrics.
Great.
We also do biometrics and labs on site, and then you don't have to take. They give you immediate
Yeah, they
results.
have Quest here.
Oh.
We just missed it.
Yeah,
Okay,
that's
so now
why.
you
We
gotta
had
go.
just started a new role.
Okay.
We just started with life claims.
Okay.
And it was going to impact our training time. And
So we
I
couldn't go.
canceled it and said, I did the survey and all, and said, I'll just go to Quest.
Yeah.
But I didn't realize you couldn't make an appointment. You just have to show up at
And then
something.
sit in a line.
Mhm.
Yeah.
Yeah.
No, it's not.
And the fasting thing. Anyways, okay. Bravo, guys. Thank you so
Thank
much.
you.
You're amazing.
Thank you for your time.
Amazing.
It was very nice
Yes,
to meet
thank
you.
Yes, thank you so much.